what really happens when you get COVID? Don't most people get the flu and get over it? Can't my immune system cope with this illness? So
my background is I was actually running a ward full of COVID patients. So I actually look after them and also look after patients who require advanced respiratory support. So just to give you a perspective, so COVID and flu, flu is actually caused by this influenza virus, and as we all know, and the incubation period, what we call as the time, difference of what people can be infectious, varies between 3 to 5 days. The difference with COVID is it's almost similar in the presentation, but the late manifestations we see after 14 days of having the COVID is something which we don't see with the flu. So to start off with. And what I mean by late complications is people actually go on to what we call as acute respiratory distress syndrome, which means that their lungs are actually filled with fluid, and to the point that they actually require immediate respiratory support to actually live. So that can actually happen and very quickly in COVID patients. The main difference between flu and thing is the mortality we see. Mortality, I meant, people dying of COVID. It varies, according to the new statistics which has come through. It is actually around 3 to 4%, which means 3 to 4 out of 100 who get COVID can actually die. The mortality from flu, if you look at the statistics from Australia and also from UK, it's actually borders to around 0.1%.
So one of the questions people have is, normally it takes us, Pradeep said, we've had the flu vaccine around for years, we change it every year. So normally it takes a long time to develop a vaccine for a bug. And yet suddenly we've got vaccines within 12 months or something like that, which is, amazingly quick. And so the concern is that are we kind of still in experimental territory?
Oh, they're very much genuine vaccine in terms of the efficacy. Do they work? Absolutely. Cutting down 1,000 deaths a day down to 25 or 50. What a huge difference. It's like 20, 40 times less, which is, just remarkable, really. So are they experimental? No. Well, I think there's been so many given worldwide now, just massive numbers.
The science has been done all correctly and in the right time frame and very, very carefully, and that hasn't been rushed. What's been sped up, as Lee's nicely pointed out, is the administration side and the approval. But as Lee pointed out, there's lots of money's gone into this. So most of the vaccine development time is attracting funding, and then you make a few vaccines, and then you've got to attract funding again and get more approvals and go on to the next stage. And it takes step after step after step, and it takes years and years and years. This time it's all been done in parallel instead of one after the other. And that's what's been sped up, is the administration and the approvals, not the science. The science is absolutely fantastic, and billions of people have already had these vaccines. They're not experimental and they work really well.
Why do we need so many people to get this vaccine? It's often quoted that we need at least 80% of the population vaccinated. In some countries, people have just had COVID and there's this concept of herd immunity. Why are we pushing so hard to get as many people vaccinated as possible?
Yeah, fundamentally herd immunity, but it's also, I guess, the impact on the health system as well. So to have, like Pradeep's already explained, the vaccines has really impacted on the amount of people with acute disease. So that's going to be reduced. The hospital system will be able to cope much better with more people vaccinated. As an Aboriginal man, my community is highly vulnerable. We've got higher rates of comorbidities that occurs at a much younger age as well. So extremely vulnerable. We've got higher household numbers, more contacts in community. So all these reasons for transmission of diseases are much higher in Aboriginal communities where it can be spread much more easily. So it's extremely important that we're protecting our community through vaccination, through social distancing, and all public health measures.
Some of the concerns are about the long-term side effects of having the vaccine. People have heard about clots and heart problems, and people dying from vaccinations? What's the risk of having a vaccine versus, what's out there at the moment with COVID?
So with any medical decision, if you're going to have an operation or anything we decide, it's a risk-benefit analysis. And the risk-benefit for these vaccines is definitely in the benefit. Now, the risks with the vaccine are very, very small. So if you had the MCG full of 100,000 people and you vaccinated all those people with the AstraZeneca vaccine, depending on your age group, about 2 or 3 people might get a blood clot. And a few months ago, when these blood clots were new from the AstraZeneca, they caught us by surprise and a few people did die, and that's public information up on the TGA website. But now we're much better at diagnosing it early. People are much better at coming in early, and we're not seeing people die from that anymore.
Well, look, it's mostly, there's actually very, very few contraindications, like true contraindications to getting any of the vaccines that we have available for COVID, whether it's the AstraZeneca or the Pfizer. And pretty much all it comes down to is if you've had a really severe allergic reaction, like we call anaphylaxis, to your first dose, then you probably wouldn't have the second dose, but that's a really, really rare event. And another one would be if you have anaphylaxis to something that's in the vaccine.
What about pregnancy? Because that's been one issue. There's been a lot of confusion around what to do. What's the advice on pregnancy?
There's been no evidence of any problems. So there's been no evidence of any risk of, say, miscarriage, or any risk of stillbirth, or any risk of any like birth defects or anything like that. What we do know, though, is that if you're pregnant, you might be at increased risk of getting particularly unwell, especially if you get infected in your 3rd trimester or you've got underlying medical problems. So the current advice is just really straightforward. It's like, if you're pregnant, get vaccinated.
So first question, if I refuse to have a vaccine and my employer requires me to have one, can they terminate my employment?
If there is a public health order, which at the moment the government has published it, one today and one on Friday, then you will need to get the vaccine. Your employer can require you to get the vaccine because the public health order is law. If you have a medical exemption, then yes, your employer can try to redeploy you into a different role where you're not as exposed. But where a public health order exists, you have to get the vaccine because that is law. In the event that you choose not to get the vaccine and you don't have an exemption, but you're just choosing not to get the vaccine, then the employer has the right to terminate your employment because you're no longer meeting the inherent requirements of the role.
Yeah, I don't have statistics or numbers. I just have jobs. And last week I went to a job. I went to a small unit in southwest Sydney that was on a high level of a building. There was a single mum with 2 children. One of the children was special needs, and he goes to a special needs daycare. And while at the daycare, one of the carers had COVID and has passed it on. He caught the virus and he also passed it on to his sister. The mum had had her first dose of vaccine a little over 2 weeks prior to them contracting the virus. So this family of 3 are living in a 2-bedroom unit upstairs in southwest Sydney. They can't go out. They can't go to the park. They can't go walking. They can't do anything. They're trapped. Yet in this tiny unit, every test that mum has had so far, and it had been roughly 16 days since the first child had been diagnosed, mum has continued to test negative. If she had tested positive, if she hadn't been vaccinated, there's a very good chance she would have been tested positive. I would have had to be calling police and social services to work out who could look after the 2 children if I had to transport mum. That small needle, and I go to a lot of people who call us with side effects from the vaccines, and mostly their fevers, their headaches, their lethargy. I give them Panadol. They either stay at home or they come to hospital and they're discharged 2 weeks later. That is so much worth it for that mum to continue to be able to look after her children.